Here we go. I still get butterflies, dog. I'm human. Big Money Bound TV, RRT Posse, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time, but I also release some unscheduled videos throughout the week. Now, if you're returning, welcome back. I appreciate all of the support. Thank you. Today's video, this for my students. I know how it is in that program. You get into that hospital and you see that doctor and you like a deer in headlights. And you afraid to communicate with the doctor back and forth. You scared to just talk to the doctor. I can tell you how to deal with this. This is very simple. We're going to break this down to the very, very basic parts of human function. All you got to do is keep watching. Keep watching. What we represent, man?
Big Money Bound.
Say let her know, man.
Big Money Bound.
I'm going to start this off by being honest with you. I'm going to be honest with you, dog. If you afraid to talk to a doctor, something going on in your head, dog. Hey, it's something going on in your head. How do I know? Because it was something going on in my head. Let's break this down to like just the basics. Let's break this down to the level 1. I'm afraid to talk to a doctor. I'm afraid to talk to a human. Like when you think about it, it's crazy. Like I ain't even trying to be funny. I'm afraid to talk to a human? What the hell? So it's like, first you gotta like target the problem that's like going on in your head. Like for whatever reason, like that you're afraid to talk to the doctor. You may look at like the doctor is at the top of the ship. I'm really in here with the doctor. He's giving orders. Now I'm here talking with him. Or like you let the Hollywood, the movie world mess with your head. And every time you turn to the doctor screaming out, hey, hand me that. Everybody clear. Get it back. Like it ain't nothing like the movie. So for whatever reason that you nervous to talk to the doctor, in your head, everybody's situation is different. It was my head. I was scared too. Why? It was in my head. It was in my head. We can say like, oh, well, it's because it's a person I don't know and I'm scared to talk to them. Like I'm nervous around new people. But yet you go into the fast food restaurant and order all kind of hamburgers and cheeseburgers and french fries and sodas and lily dillies and cupcakes with no problem. Ain't no problem then. But you don't know him, just like you don't know the doctor. But it's just that it's the doctor. It's the doctor. You feel me? The word doctor. The DR. So you just gotta like tell yourself whatever you gotta tell yourself to get over the fear of just talking to the doctor. Just saying something. Now, if you know in your head you ain't ready to talk to that doctor, don't just go out there and just blurt something out. I like cupcakes. I like ice cream. Whoa, hey. I like you to get the hell out of here. I like you to get the hell up out of here. This ain't supposed to be that kind of video. I'm sorry. Just don't talk to the doctor until you built up enough confidence and courage to say something to the doctor. And once you do, you can take baby steps. Let's do small talk. Hey, see the doctor? Any doctor. Good afternoon. Good afternoon. Hey, I talked to him. I talked to her. Wasn't that bad. How you doing? How you doing? I talked to the doctor. Wasn't that bad. Are you the intensivist for the unit today? Oh no, it's not me. I was here during the nighttime. Someone else was coming on. All right, cool. Now you're getting conversations going on. Now, once it's time to really like start like a full conversation with the doctor about a situation that's pertaining to a patient, what you want to do is, for example, you got a patient that's on room air. You draw blood gas on the patient with your preceptor. You then run the blood gas. The blood gas has a low PaO2, so which means you should know this. You should all know. If you don't know, the patient needs more oxygen. They're on room air, may need a non-rebreather, may need a venturi mask, may just need 4 liters. It depends on what's the PaO2. So you then go and talk to the doctor. But you bring a problem and you bring a solution. You don't just bring a problem and no solution. That's not a good look. You sending like the wrong message. Yeah, that guy can't breathe. This patient they're saying he can't breathe and his oxygen is low. What do we do? What do we do? Aren't you the respiratory therapist? We gotta communicate back and forth. Here's another example. Patient can't breathe. I did an ABG. The PaO2 is low. I suggest we put the patient on like a 50% venturi mask, and the sat should return to normal. The doctor, you know what? That's a good idea. But instead, let's put them on 100% mask and let's wean it down as we go. I prefer to be more aggressive than like to start off with less and go higher. Now you gave a solution. They said that's okay, but I got a better solution. Now we talking back and forth. Now it's communication skills. And then with that, you just build upon it. You just get more comfortable, more comfortable, more comfortable, more comfortable. During the cold situation, the respiratory therapist's job and question for the doctor remain the same. All you're saying every time is, what size blade do you need? Some doctors like Mac 3, Mac 4. Some doctors like Miller 3, Miller 4. Some doctors like blade scope. So it all depends on the doctor, but you gotta ask, what size blade do you need? You get that answer. What size ET tube would you like? You get that answer. Suction is set up, somebody that's ambuing and bagging, and that's what you do. That's your communication with the doctor. Okay, and I'll get after the intubation, okay, and I'll get an ABG in 30 minutes. Now you're communicating with the doctor by tubes, ET tubes, blades, ABGs, vent settings on top of that. So it starts with your foundation. First things first. Whatever going on in your head, you gotta fix that. Then secondly, this is humans talking to humans. Thirdly, small talk. Small talk. Good evening, good afternoon, how you doing? I'm good. What's popping? What's happening? Okay. Fourth, when I start having fun with it, I'll be done with it. Fourth, nice conversation. We really communicate about something on like a serious level. Now you bring the problem and you bring a solution, not just a problem. That's not only gonna help the communication process, also gonna help you like gain respect from that doctor. Then soon it's gonna be whatever you recommend, that's what they're gonna go with. That's how it's been for me. That's what I seen happen over the years. I started out, gave a suggestion. I don't know you, get out of here. A year later, gave the same doctor a suggestion. I like how you're thinking, keep up the good work. And that's how it goes, man. Let me know if I helped you. Anybody watching who got some more tips and advice, please drop the comments. RRT Posse, this is the community. I need you. The posse needs you. We all need your help. We all just trying to better the world of respiratory therapy. I want to see everybody get out there and make it happen. Because it's possible. God real. Thanks for watching, dog.